You may have heard reports on people experiencing severe allergic reactions after receiving either the Pfizer or Moderna COVID-19 vaccines. If you are someone with allergies, whether it be to pets, pollen, or certain medications, you may be wondering if you should or should not receive either the Pfizer or Moderna COVID-19 vaccines. I'm here to answer this question for you today. Hi, I'm Leanne Varga, a pharmacy student working with Dr. C. Michael White, a pharmacist and distinguished professor at the University of Connecticut School of Pharmacy. This is a part of a series on the Pfizer and Moderna COVID-19 vaccines, and we hope you find it informative. This general information is our assessment of the COVID-19 vaccine literature, and it's current at the time of recording. This is not a substitute for medical advice from your personal healthcare provider, and if you're experiencing a medical emergency, please call 911. We are not receiving funding from Pfizer, Moderna, or any other group, and we just want to help you make an informed decision. If you are someone with a history of severe allergic reactions that are not related to vaccines or other injectable medications, then the CDC recommends that you do get vaccinated and that you can receive either the Pfizer or Moderna COVID-19 vaccines. So that means that everyone with allergies to pollen, food, pets, latex, oral medications, anyone with seasonal allergies, or anyone with a family history of severe allergic reactions may all get vaccinated. Every person who receives a COVID-19 vaccine, whether or not they have a history of allergies, is required to stay for a minimum of 15 minutes after receiving their vaccine, so that they may be monitored by healthcare providers for any potential allergic reactions. Anyone with a history of anaphylaxis, which is defined as a severe allergic reaction that requires use of epinephrine, an EpiPen, or a trip to the hospital, is required to stay for at least 30 minutes after receiving their COVID-19 vaccine. Additionally, every vaccination site is required to have all medications and equipment needed to treat severe allergic reactions. These safeguards include epinephrine, antihistamines, blood pressure cuffs, and more. If you are someone that has had a severe allergic reaction to any ingredient in the Pfizer or Moderna COVID-19 vaccines, including polyethylene glycol, then the CDC recommends that you do not receive either the Pfizer or Moderna COVID-19 vaccines. Additionally, if you are someone who, after receiving your first dose of the vaccine, experienced either a severe allergic reaction or a non-severe immediate allergic reaction, which consisted of hives, swelling, or trouble breathing, then the CDC recommends that you do not receive your second dose of either the Pfizer or Moderna COVID-19 vaccines. Lastly, if you are someone who has had a severe allergic reaction to a different vaccine or an injectable therapy for a different disease, then the CDC recommends that you ask your doctor if you should receive a COVID-19 vaccine. It's important to note that for those worried, anaphylaxis is extremely rare after receiving either the Pfizer or Moderna mRNA vaccines. To be exact, the rate of anaphylaxis after receiving either Pfizer or Moderna averages 6.8 cases for every 1 million doses. Also, all patients with follow-up information available had recovered from their allergic reaction and were discharged. Thank you for listening.